Hi, everybody. I'm Dave Ryan, the Chief of Hematology Oncology here at Mass General and the Clinical Director of the Cancer Center. We are here today to welcome you and to tell you that we are ready, willing, and able to care for our cancer patients. The multidisciplinary teams are still working together to provide you the best care possible, and your safety is our top priority. That's why I've assembled three of our great leaders here at the MGH Cancer Center, and I'm going to ask them to introduce themselves. Let's start with Erica.
Hi, everyone. My name is Erica Rosado, and I am the Director of Ambulatory Oncology Clinical Services.
My name is Kellyanne Jeffries. I'm the Director of Advanced Practice Oncology Providers.
And I'm Effie Hochberg. I'm a medical oncologist, and I help manage clinical operations for physician practices at our multiple network sites.
So let's start with Erica. Erica, what's being done in the infusion center to ensure patient safety?
Right. So as you know, Dave, we have been open for business throughout the pandemic. In fact, we have been operating at 75% of our normal volume, which is amazing. So what we've done for safety is we've instituted state and Mass General Hospital infection control guidelines and mandates, including a strict cleaning procedure that is being done in our clinics and in our infusion centers to make sure all areas are clean and disinfected. Staff have been trained in these additional cleaning procedures, and time has been allotted in between patients so that we can provide that time for cleaning. We also have waiting rooms that have been totally modified. We have literally reduced the waiting rooms by 50% of the chairs that are in that waiting room to allow for social distancing in the area. And what we're trying to do is bring patients back as they come in directly back to their clinic or infusion appointment. Again, we want to minimize waiting time in those areas as much as possible. And finally, we're doing a pathway to care for our COVID positive, exposed, or risk patients. These patients still need to be treated, if deemed appropriate, by their provider to come in for care. So we have a designated area in infusion and in the clinics that have designated rooms for these patients. And all of this has been approved by our infection control team here at Mass General. So we've instituted the changes to address our patients' anxieties, their concerns, and anything they might have in relation to regard to their safety in our cancer center.
Oh, that's terrific. Kellyanne, what is the Cancer Center doing to protect patients, visitors, and employees during this pandemic?
So safety we have a very high expectation for safety here at the Cancer Center. Masking and screening programs have been two of our larger scale protection efforts that we've had. One of the ways we continue to do this is through the masking program. It's for all patients, all visitors, and employees. They must participate in a hand hygiene exercise and wear the hospital-issued masks when they're on our premises. For the screening, we have our employees are screened daily and for symptoms prior to presenting to work. Additionally, we have pre-screening efforts for our patients that are scheduled. When patients come on site, plus minus any visitors, they will be screened for symptoms upon arrival as well. Lastly, we're committed to the evolving needs of our patients at this time. And so some of the other things that we've done to keep our patients safe is leveraging our weekend care options, our telehealth, and our virtual care. Our goal with that is to ensure that our patients have the right forum for the needs that they have at that time while maintaining a seamless connection to the team.
That's terrific. So, Effie, what choices do people have if they don't want to come into Boston? Can we still take care of them?
That's a great question, Dave, and there's a couple of ways we've tried to address that. One of the unanticipated benefits of this pandemic, if there can be any benefits in this difficult situation, is that we've all become a lot more comfortable, as you're seeing us now on Zoom calls, and we've really adapted the way that we care for patients to this new era. We have all of our providers comfortable with virtual visits. So when people call into our cancer center, they can see us in one of a couple of different ways. They can either see us virtually over Zoom, if that's appropriate for a first visit or a discussion of the plan of care, or they can see us at one of our network sites, either our more distant network sites or our closer network sites in Danvers, in Waltham, and Newton Wellesley Hospital, and we provide exactly the same care at those sites. In most cases, it's the same providers who rotate between our different locations, who might be in Boston one day, then out in Waltham the next. So we're very comfortable that we're adapting the way that we care for patients to make it as safe and convenient as possible in this new era of patient care.
So everyone, I hope that reassures you that the Cancer Center is safe, and we are in the middle of this pandemic, still taking care of everybody's Cancer Center needs, and it hasn't changed the Cancer Center. Clinical trials, multidisciplinary teams, and subspecialty care that we've become known for are still there and still serving you so that you have the best chance for the best outcome. And you'll see a greater emphasis going forward on distancing and sanitizing and all the ways that we're taking to keep you safe. So thanks very much, and take care.